to rural areas. Time and again, there have been reports of inaccessibility to some of the far-flung areas within the country, so much so that the people living there are unable to access very vital medicines and services that are needed to ensure good health. Now, the Joint Medical Store is one of the entities that have made it a point to ensure that some of these medicines and other supplies do reach areas that perhaps are not reached by the mainstream suppliers from government or any other sector players. Joining me for this discussion this morning is the Executive Director of the Joint Medical Store, Dr. Bildad Baguma. Thank you for joining us on Morning at NTV. First time to see you here.
Thank you very much.
And I guess you've been around?
Yeah, I've been around here a few times, and it's a pleasure always to be here. And good morning to our viewers.
We're glad that we are able to amplify these particular messages as you do roll out these services across the country. First and foremost, tell us about Joint Medical Store and the kind of milestones you are registering in the supply chain when it comes to accessing medicines by far-flung areas in the country, but most importantly, being able to reach where government perhaps is not reaching.
Yeah. No, Joint Medical Store is an institution that was set up 43 years ago. It was set up just after the war of 1979, jointly by the Uganda Protestant Medical Bureau and the Uganda Catholic Medical Bureau. And it's the basic mandate that we have is to ensure that we have that facilities, both the private not-for-profit and also the NGOs and the private for-profit, have access to quality, affordable health solutions. That's what we stand for. And over time we have set up capacity and infrastructure to serve these facilities from wherever they are. From a small entity in a warehouse, as I said, 43 years ago, we have now built capacity, set up branches in Kampala, in Fort Portal, in Arua, in Mbarara, and we are currently setting up 2 more in Gulu and in Mbale, in order to make sure that we are close to the facilities and can serve them. But in addition, we have set up systems that can enable facilities to access services without necessarily having to make a physical visit. Through the ERP system or software that we use, facilities can access our services anywhere where they are. But also, we provide what we call last mile distribution, meaning that once a facility makes an order, we deliver up to the door of the health facility. And in so doing, then the facilities can concentrate on their core mandate, which is the care for the patients. Yeah.
Okay, and what kind of synergy is being created with the other stakeholders within this sector? For example, the Ministry of Health, the National Medical Stores, and all the other partners that work within the health sector to ensure that service delivery is, first of all, improved, but much of these supplies reach as many people as possible and in a prompt manner.
As I told you earlier, we are a non-government organization. We're a trustship. But we also work very closely with the other players. Among the things we do is we work with the Ministry of Health very closely. We have a memorandum of understanding with the Ministry of Health to work as an alternative warehouse. In other words, if for any reason the government warehouse, which is National Medical Stores, needs any sort of support from our side, then the Ministry of Health can come to us and we provide that support promptly. We also work very closely with National Medical Stores because for some of the commodities that we deal in, for example, commodities that are provided by development partners, we work closely. We have a forum where we know as a country what commodities do we have. If let's say we are HIV commodities, we know that these commodities are in NMS, these ones are in Joint Medical Store. And if for any reason there is a need for commodities to move from one warehouse to another, that happens seamlessly. But we also sit on fora various fora of the ministry where some of these decisions and coordination is done.
Okay, yeah. Wow, that's very, very interesting. Now, talking about storage and distribution of some of these supplies, we saw during the height of the COVID-19 pandemic, there were concerns about the longevity of the vaccines and the ability of the Ministry of Health to ensure that they are in shape or stay good and safe for vaccination at a later stage. When it comes to storage of medical supplies, especially medicines, including vaccines that are very brittle to handle, what is the model that is being applied? For example, if Arua, Kitgum, Bundibujo, or even Kisoro, are there focal points, or we're simply looking at the fact that either Gulu, Kampala, Jinja, and perhaps Mbale remain the distribution centers? Is there a mechanism to ensure that some other places serve as, you know, points where most of these supplies can be gotten long before we look at Kampala?
Yeah, as I told you, talking from the perspective of joint medical store, because that's where I can talk comfortably. That's right. We have established branches, as I've mentioned to you. So we have branches. Right now we have 4 branches, one in Mbarara, another one in Fort Poto, one in Arua, and as I told you, there's one we are establishing now in Gulu. In addition to that,
billion shilling warehouse.
Yes.
Wow.
Yeah. Okay. So in addition to that, we have set up what we call distribution centers. So there are distribution centers right now, one in Masaka, there's one in Jinja, and for these ones, they act as sole distributors for JMS. So meaning that a facility that is nearer there and maybe for some reason cannot order online, wants to be physically reach the store, they can actually access those ones. Yeah. But also we do, as I said, last mile distribution, meaning that even a facility in Chisoro, we can actually reach it. We have pre-scheduled order delivery schedules, and we can reach every part of the country in a very short time as well.
Okay. Yeah. Recently, I was reading in one of the leading dailies about plans by the Ministry of Health to begin manufacturing oxygen within the setup of the National Referral Hospital. However, in 2020, the Joint Medical Store also revealed plans to be able to manufacture oxygen within our own settings here. I do not know how far that is. Could you give us an update?
Yeah. Yes, we looked at the issue of medical oxygen even before the crisis of the COVID-19 pandemic, because we know that more than 50% of the people that actually need medical oxygen in hospitals do not access it. And the reasons are mainly 2. Either it is a problem of diagnosis or it is a problem of availability. And so we set out to have a project, a comprehensive project that would address both. In other words, how do we work with health facilities, first of all, to make sure that they have ability and the necessary equipment to diagnose who needs oxygen at any one time, but also have the oxygen available, high quality oxygen available. So we started plans to put up an oxygen plant. Later on, in fact, we were rather disrupted by COVID. When the pandemic came, so many things didn't move as fast as they should. But we have now completed the construction. We have completed the installation of equipment for the oxygen. We have the cylinders here. So by the beginning of September, which is literally next week, we have been now doing the test. So we are ready now. We'll start rolling out the oxygen. We will be producing for the beginning 120 oxygen cylinders a day, and we think these will go a long way towards bridging the gap in the supply of medical oxygen.
How does that factor into the national demand for oxygen if you're producing that number in a day? Are we meeting sufficiently the need for, especially the demand across the country?
Yeah, there are other players. There are other players, and we think that's not enough, certainly, but we have to begin somewhere. Okay. So we think that will add to the already existing supply of medical oxygen, and our plan is to grow that to maybe 3-4 times that capacity in different areas of the country over the next 4-5 years.
Okay, talking about growing capacity as a country to be able to manufacture many of these much needed medical supplies, the aspect of pharmaceuticals being largely dependent on imports from India, Pakistan, and a bit of Germany, UK, so much so that on the counter, when buying some of the drugs and other supplies within the medical space, people ask questions. I want India, I want Pakistan, I want Germany, I want UK. Our own capacity to manufacture some of these supplies is no doubt not something that is really rocket science. A few things have to be put together so that we can be able to do that. How far are we in ensuring that local manufacturing of pharmaceuticals is actually undertaken?
No, I can't agree with you more. Beyond that, I think for me the COVID-19 pandemic, if it taught us anything, was that as a country we need to have commodity security for health commodities. And a lot of efforts are being made, which we applaud from the JMS perspective. I know that the government, for example, set up the Boo policy, which we also support in terms of ensuring that those producing medicine locally are actually protected and maybe reduce the level of imports. Because right now we are at about 75% of the medicine we need, or slightly more than that actually. So from the JMS perspective, we have also started on that journey. We have started with the production of some products, not necessarily some medicine, some nutraceuticals, but also, as I mentioned, oxygen. We are also now producing ultrasound gel. We are producing chlorhexidine. So we believe that it is important for us to grow in that direction and in that space. Then in addition, also because we are buyers, so we also support local manufacturers to ensure that where it is possible, we actually buy from the local manufacturers and promote local production of medicine.
That's right. Okay, talking about the cost of some of these supplies and your ability to be able to support local manufacturers, when you look at the conversation that is going on at national level, the need to front scientists and science, the study of a science in order to be the catalysts for the transformation that the country needs as espoused by the president. Are you in any active collaboration with institutions of learning, either at tertiary, university, or even at lower secondary level? Are you in any kind of collaboration on that?
One of our mandate as Joint Medical Store is what we call capacity building, because we need to make sure not only that we provide supplies to health facilities, but that facilities have the necessary skilled human resources to manage them. So for us, we are not directly in the formal training sector, but we are providing coaching and training, in-service training to health facilities. But we also provide some support to the Uganda Protestant Medical Bureau and Uganda Catholic Medical Bureau to get scholarships to fund training of health workers in the health facilities. Now we are also involved in trainings. For example, we host interns from various universities whom we train as part of our real social responsibility to make sure that people are skilled in that sector.
Okay, very quickly, for the youth out there who may be looking for jobs within the science sector, and Joint Medical Store could be an opportunity. What is the scale of staff that you employ across the country, whether mainstream staff or peripheral?
Overall, now our staffing level is at 250 direct employees, and of course, in addition, we also have others that are employed or gain employment indirectly from the services we are doing. Of course, as I told you, we are also now putting up another branch in Gulu, whose construction has started. We think in 1 year it will be ready and running, and that will mean, of course, that we'll have additional people as well in that area.
All right. Thank you very much for that update, Dr. Bildad Baguma, the Executive Director at Joint Medical Store, for giving us an update on exactly what the organization is up to in as far as extending adequate health